Good day everyone, I'm De La Puente Yani and I will be discussing menstrual disorder. Menstrual disorders are problems that affect a woman's normal menstrual cycle. They include painful cramps during menstruation, abnormally heavy bleeding, or not having any bleeding at all. Menstrual disorder usually caused by hormones, health conditions, or lifestyle factors. There are common types of menstrual disorder. These include the dysmenorrhea, painful menstruation characterized by cramping in the lower abdomen, often accompanied by nausea, fatigue, or headaches. Dysmenorrhea is also known as the period pain or painful periods or menstrual cramps. It's usually during menstruation. Its usually onset occurs around the time that menstruation begins. Symptoms is typically less than 3 days. For the amenorrhea, this is basically the absence of menstruation, and we have two types of amenorrhea. First one is the primary amenorrhea. Menstruation has not started by the age of 15. The most common cause of primary amenorrhea relate to the hormone levels. Although anatomical problem can cause amenorrhea. And next one is the secondary amenorrhea. Menstruation stops for 3 months or more after previously being regular. Polymenorrhea. Frequent menstrual cycle occurring less than 21 days apart. A normal cycle is between 24 to 38 days long. So, if less than 21 days, yun na yung masasabi nating like polymenorrhea. Premenstrual syndrome, also known as the PMS, physical and emotional symptoms occurring 1 to 2 weeks before menstrual I mean 1 to 2 weeks before menstruation, such as mood swings, bloating, and irritability. The typically symptoms starts in 5 days before menstruation begins and go within 4 days after bleeding starts. That's PMS. Premenstrual dysphoric disorder or PMDD, a form of severe PMS naman siya with more intense emotional and physical symptoms significantly affecting daily life. For the cause of menstrual disorder, many different factors can trigger menstrual disorder. This includes the hormone imbalances. Several hormones are involved in the menstrual cycle. Because of this, an imbalance in any one or several of those hormones can cause irregular periods. We also have the genetic factors. They say na some menstrual disorders are inherited like PMS. Next is clotting disorder. Bleeding disorders that reduce blood clotting can cause heavy menstrual bleeding. For the symptoms of menstrual disorders, we have the abnormal menstrual bleeding, pain or cramping, the most common. We have depression, headaches, emotional distress, and of course bloating or fullness in the abdomen. Diagnosis for menstrual disorder. Diagnosis starts with detailed medical history and physical exam, including a pelvic exam and pap smear. Ultrasounds and sonohysterography. Imaging techniques are often used to detect certain conditions that may be causing menstrual disorder. Imaging can help diagnose fibroids, endometriosis or structural abnormalities of the reproductive organs. For its treatment, for the drug therapy, we use ibuprofen, birth control pills, iron supplements, intrauterine contraception or IUC, drug that contains estrogen and progesterone, also known as the hormone therapy. We also have surgical treatment. This includes dilation and curettage, operative hysteroscopy, endometrial ablation or resection, and lastly, hysterectomy. That's it. Thank you so much.